Urinary tract infections, also known as UTIs. UTIs are very common and are the most common infection in women worldwide. The majority of infections are acute and short lived. However, in some people, they develop complications if left untreated. In severe cases, recurrent UTIs can lead to renal scarring, which may precede hypertension and, in some cases, even loss of renal function. Why do people get UTIs? One of the reasons for developing a UTI is the imbalance of vaginal flora. The vagina consists of good bacteria, and these are known as lactobacilli. Lactobacilli are important as they help maintain the pH balance and help prevent the growth of other harmful bacteria. When there is a change to the normal flora of the vagina, a lack of these bacteria, for example, then that will allow the bad bacteria to invade and cause a UTI. The bacteria infection is usually acquired through the urethra and travels upwards to the bladder. Most UTIs are simple and only affect the urethra and bladder. On the other hand, complicated UTIs are UTIs that infect the kidneys and ureters and are more difficult to treat. E. coli is the number one cause of UTIs. It is a type of bacteria which is found in the lower intestine. However, high concentrations can lead to a UTI. Other types of bacteria can also cause a UTI, and less frequently, UTIs can be caused by fungi and viruses. Due to the closeness between the urinary tract and the vagina, sexually transmitted infections can also cause an infection in the urinary system. What are the risk factors? Basically, anything that reduces the bladder from emptying or irritates the urinary tract can lead to a UTI. For example, a short urethra in females, kidney or bladder stones, abnormalities in the urinary tract, sexual intercourse, enlarged prostate, certain diseases, some contraceptives, and lower estrogen in older women are all risk factors for getting UTIs. What are the symptoms? These depend on where the UTI is located. Generally, symptoms appear to be a frequent urge to urinate, burning sensation when urinating, cloudy urine, foul-smelling urine, red or dark urine, which is a sign there is blood, and pelvic pain in women. UTIs affecting the urethra will give symptoms of a burning sensation when urinating and discharge. A UTI affecting the bladder will give symptoms of frequent painful urination, blood in the urine, discomfort in the lower abdomen, and pressure in the lower region. A UTI affecting the kidneys would be something you would definitely need to seek urgent medical help for because you will most definitely require treatment. Symptoms are more severe and include back and sided pain, fever, nausea, vomiting, and chills. Preventing UTIs. Drinking plenty of water ensures that you are urinating more frequently and flushing out the bacteria. Taking cranberry juice in the form of a capsule or tablet or drinking it can be helpful to prevent the bacteria from sticking to the lining of the bladder. This can be purchased from a health shop or pharmacy. Ensuring you do not hold urine for long and to go when needed, as well as after sexual intercourse, ensures you are regularly flushing out the bacteria. What treatments are available for UTIs? The form of antibiotics given depends on which part of the tract is affected. Most UTIs can be treated with oral antibiotics. Usually, UTIs clear up after a few days of treatment. However, it is important to take the entire course of antibiotics. A pain medication can be prescribed to relieve the burning sensation. Antibiotics can disrupt the good bacteria causing complications. Therefore, it would be a good idea to discuss taking probiotics with your pharmacy. What will the doctor ask? Your doctor will ask you when you noticed your symptoms, if you have discomfort, frequency of urination, lower back pain, and whether you have a fever or blood in the urine. Treatment will depend on whether you have been treated for UTIs before and whether you are on any medication. Your doctor may ask you other questions such as whether you are sexually active, if you have contraception, and whether you could be pregnant. To conclude, UTIs can be easy to treat. However, recurrent UTIs are common, especially in women. Some recurrent UTIs may require further evaluation since the cause could be an abnormality in the structure of the urinary tract, increasing the risk of UTIs. If you are pregnant and suffering with a UTI, talk to your doctor immediately because they can be more serious, increasing the risk of kidney complications and premature delivery.